Hello, my name is Rahul Ricky. I am a physical therapist and MD candidate at St. James School of Medicine. I'm going to present to you today the physical examination of the knee. This is a topic that is very close to my heart as I practiced within orthopedics prior to coming to medical school. I hope you enjoy it. So, let's get started. Whenever we look at a knee head-on like this, we're always going to want to find the fibula first. Why? Because it can orient us. That means this has to be the lateral side because the fibula is always lateral. That means this has to be the medial side. The structures that we are going to look for today are the MCL, or medial collateral ligament, the LCL, the lateral collateral ligament, the ACL, the anterior cruciate ligament, the PCL, the posterior cruciate ligament, the lateral and medial menisci. All of these ligaments do one thing that every ligament in the body does. It resists motion. The menisci are special structures within the knee that serves as a lubricating surface for the femur gliding upon the tibia. The first special test that we're going to go over today is called the anterior drawer test. So you're going to get the patient into a supine position and a 90 degrees flexed knee position. You're going to pull on the patient's tibia anteriorly towards you. It's easier to see it. So as you can see, the examiner is stabilizing the foot and he is pulling the tibia close to him. This is creating excessive anterior translation. This is a positive test. Similarly, we have the Lockmans test, which also tests for a torn ACL. In contrast with the anterior drawer test, we're going to stabilize the femur and we're going to have them in less flexion, only 20 to 30 degrees. We're still going to pull anteriorly. It's better to see it. So as you can see here, the examiner is pulling anteriorly in the tibia. There's anterior translation of the tibia, and we're stabilizing the femur this time. In order to test for a posterior cruciate ligament tear, we're going to use the posterior drawer test, which is very similar to the anterior drawer test, except you're pushing backwards. As you can see here, the examiner is pushing backwards on the tibia, and you can see very profound posterior translation. This one is important because the MCL is the most commonly injured ligament of the knee. In order to test for it, we're going to use the valgus stress test, also occasionally referred to as the abnormal passive abduction test. In order to do this, what we're going to do is we're going to apply a lateral motion of the tibia, and then we're going to apply a medial motion of the femur. What this is going to do is provide a valgus force stressing the MCL on the inside of the knee. Although lateral collateral ligament tears are quite rare to happen by themselves, you still have to learn how to test for it. We're going to use the Varus stress test this time. And if that sounds familiar to you, good, because it's like the valgus stress test, except we're putting our hands in different places. So what we're going to do is provide a medial force to the tibia, a lateral force to the femur, which will stress the LCL, and that will provide a Varus force this time. And a positive test is excessive medial translation of the tibia. Okay, I hope we feel pretty good with ligament injuries because now we're going to get into something a little bit more complicated. But don't worry, we're going to break it down and you're going to do great. Okay, before we get into special testing the menisci, can you tell me what kind of cartilage creates the menisci? If you said fibrocartilage, good job. So the theory of meniscal testing is that we're going to rotate the foot in the opposite direction of the meniscus that we're going to test. So what I mean by this is in order to test for the lateral meniscus, we're going to get the patient in the supine position, we're going to passively flex and extend, and we're going to internally rotate the foot, and we're looking for a click. A click is a positive test. Similarly, in order to test for the medial meniscus, what we're going to do is externally rotate the foot and then still continue to passively flex and extend the leg. What we're going to do is look for that very notable clicking sound, and that is very indicative of a meniscal tear. Meniscal testing in particular can be pretty easy to mess up. So a mnemonic for you to remember the meniscal testing His lateral meniscus is internal rotation, and medial meniscus is external rotation, also known as Lyme. One pathology that we must keep in mind is the unhappy triad. And this happens in high impact, high contact sports such as football, soccer, etc. What's going to happen is a player is going to get hit from the outside in, and remember that could be either way, with his or her foot fixed to the ground. What this is going to do is create anterior translation of the tibia. Which structure are we thinking of? Good. The ACL. Valgus force. Which structure are we thinking of? The MCL. Very good. And external rotation of the tibia. Which structure are we thinking of? The medial meniscus. Good. So remember, the unhappy triad is the ACL, the MCL, and the medial meniscus. ACL, MCL, medial meniscus, unhappy triad. Don't forget it. Okay, let's put it all together. A 41-year-old professional football player comes into the emergency department after being tackled with his left foot planted on the ground and heard a loud pop. When asked about the point of impact, he points to his fibular portion of his leg and brings in the picture presented below. His knee is grossly erythematous and he cannot bear weight. Past medical history is unremarkable, and he is in otherwise excellent health. Vital signs are within normal limits, but he is in 10 out of 10 pain. What special tests do you plan to do as part of your physical exam? I will give you 20 seconds. Please answer, and we'll go over it. All right, so if you picked C, you're correct. It's going to be the valgus stress test testing the MCL, the Lockmans test testing the ACL, and the McMurray's test with the leg externally rotated to test the medial meniscus. And yes, this is Tom Brady of the New England Patriots when he was still on it. And that's it. I appreciate your time, and I sincerely hope to work with you further. I had a lot of fun making this video, and I am so happy that you are giving me the opportunity to work with you guys. I appreciate it. Thanks. Have a good day.